I was surprised how quickly I filled up just because there was such a need for therapists who could see those type of kiddos. And so kind of quickly realized I needed to, figure out how to either slow down or to hire more people to meet the need that I was seeing coming in. So I loved it, but it just takes a lot of time to build a business and to make it work and to make it grow.
Hey, everybody. Welcome to another exciting episode of the Trust Driven Podcast. I am your host, as always, Dr. Josh Satterley. I'm joined today by the amazing Carrie Manning. Carrie, how's it going out there?
It's good. How are you?
I'm good. So for our listeners, Carrie is she's in the mental health space. I'll let her explain what that is, since as a chiropractor, I can't keep track of all the different, mental health licenses, who's a licensed family and marriage counselor and a social worker and all that. But, and you own a counseling clinic out in Fort Worth, Texas, right?
Yes.
Yeah. So tell us about it. What's the name and what do you guys, who do you serve? And
I have a group private practice. It's called Reach Counseling, and we specialize in working with children and teens, mostly using play therapy. We also see adults, but the majority of our clients are younger. And right now we have 7 therapists, and we've grown pretty quickly, but we're really excited that we can provide services that are specialized because I feel like a lot of families are looking for support and help for their kids.
yeah.
And, it's harder to find a counselor that works with that age range.
I notice it in a lot of our mental health clients in Trust Driven Care, like that a very large portion of what they do typically is telehealth. But doing play therapy, are you guys almost exclusively in person? Are you telehealth? How does it work?
Most of our is in person. I mean, we do provide some telehealth for, especially if they're teenagers or adults, and that works a little bit better. I do have some groups that are virtual. I have a parent support group, and we just started a teen social skills group that's virtual as well.
Okay. And that's group therapy. That's interesting. Yeah. As a chiropractor, like we don't do any,
Yeah.
like, there's no like working on 10 people at the same time, it's one after the other. How'd you get into having your own practice and counseling and everything like that?
Yeah, so I was actually a school-based counselor for our local public schools. I was a special ed counselor and traveled school to school, helping kids that had counseling services on their IEPs, and a lot of kids that really needed a lot of support to help them get through the school day. So I did that for a long time. I loved it, but school's gotten kind of hard. Education's kind of gotten hard, especially after COVID. I feel like
Yeah.
after that many years, I was starting to feel a little bit of burnout. I really enjoy. I'm trained in play therapy, and I didn't get to do that a whole lot in schools the way I wanted to. I was kind of limited with the time that I had with kids and the space, and so I just started to really have a desire to create something of my own that I knew that would be more helpful for kids and families, and to really be able to provide the services the way that I wanted to provide them. So I started private practice, just kind of trying it out, but I loved it, and I love being able to work more closely with parents. And I was a solo practice for about a year before we added.
And was there a clean cut, like you totally left the district before you started, or was there some like kind of moonlighting a little bit in the afternoon?
Little bit of overlap. I started seeing clients like in the evenings, and so I was doing both for not for very long, for about months before I left the school district.
But it was the
Mhm.
glory of business ownership. You got to choose your own hours. You're like, yeah, great. If
Yes.
6 to midnight on your day of the week.
I love having my own office because I was traveling all the time between schools. I didn't have like my own space, so I was loving it. That freedom
Yeah.
to do my own
Yeah.
thing.
My sister's actually a special ed coordinator for her school district. So she helps the teachers, the education side, kind of best practices and groups. And she's the complete opposite of me, Carrie. She's a total introvert, very quiet, doesn't like public speaking. And, you've been around me long enough to know, like, I can't get enough of those things. She's very good at what she does. And interestingly, she was saying that she gets that position and is like, hey, let's just do a group Zoom call. And they're like, what's it for? She's like, just to hang out and talk and get to know each other. Yeah, but what paperwork will we have to fill out at the end of it? And she's like, nothing. Let's just do a social call. And it was crazy, big district. And like some of the special ed counselor or the special ed teachers had never met or seen or been around other teachers doing the exact same role in the exact same district that, because it's a very large district in Southern
Yes.
California.
Uh-huh.
And so, you might physically be 20 miles away, but she was like, just breaking down that wall for best practices was a monumental thing. And she's like, what are we doing?
Right, to help people not feel so isolated and alone. And I do feel like, yeah, teachers, especially
Yeah.
teachers that have specialized, things where they're the only one that does that on their campus, that is hard.
And for those listening, if they don't know, I only know this from my sister. IEP that you talked about, what is that? Individualized education plan.
Yes.
Yeah. But it adds this layer of stress, especially in special ed, of you're legally required to provide
Yes.
these, like for you were legally required to provide X amount of counseling every week to this kid, right?
Yes, if it's written into their plan, we're required to provide those minutes for them.
Yeah. That's a stress builder, I'm sure.
What was hard for me is just because we were limited with, there was actually only 2 other counselors in our district, we felt pressure not to add minutes to kids' plans that needed minutes. And that's really hard, when the kid is really needing.
Because you knew you couldn't fulfill on it if you
Right,
promised it.
because we could only see them once a month, but that's not really going to be helpful for a kid that has a big social anxiety or emotional disturbance that they're really having trouble functioning and in school and need more support.
I'm glad there are people like you out there that provided it. I think it is a tough thing, and I had this patient one time that was I just remember this. I think this is like a synonym for all management positions, whether it's a school district or. So she was a manager of a restaurant, and she was well paid by a large, it was a cheesecake factory. So like and she would go into problem restaurants and turn them around, which can be a lot of things like getting the staff hours correct, or, someone needed to be updated and change the menu and all sorts of stuff. But she said what always happened, she said, yeah, by the 3rd year, we've made so many changes. She said that leadership would always be like, okay, so next year, we want you to do X amount of business. And she said, I always have to tell them, there are only 42 tables in this restaurant. And what you're saying would take 60 tables. So like, we can't, there's nobody on earth that could hit those numbers, no matter how hard we worked or how much staff or how much food. And they're like, yeah, but we want to see you hit these numbers. And she's like, great, spend $7 million to build a new building that has 60 tables. Well, we have to go, we have to do more with less. And she's like, what you're saying is impossible. And I think my sister gets into this. I'm sure you got into this. Like, we don't have those hours. So hire somebody. Well, we don't want to hire anybody because it's expensive.
Yeah.
So when you went into private practice, what were the first kind of early years like, or early months like in your space? So once you had your own space.
Yeah. So I just really enjoyed, we, had a play therapy room. Especially since my background in special education, I specialize in working with kids who are neurodivergent. So that looks like autistic kiddos or ADHD learning differences. And so I filled up. So I was surprised how quickly I filled up, just because there was such a need for therapists who could see those type of kiddos. And so I got full really quickly. And so kind of quickly realized I needed to figure out how to either slow down or to hire more people to meet the need that I was seeing coming in. So pretty quickly, I realized that I was probably going to expand into group practice just because there was such a need. And I kind of like that idea, because sometimes being a solo therapist, it's kind of lonely. I like the idea of having a team and be able to kind of have people that have the same vision and have the same skill sets that I can work with and build that team. So I loved it, but I felt like it was almost like it was hard in a different way, running a private practice, and just it takes a lot of time to build a business and to make it work and to make it grow, and learning all, they don't teach us the business stuff in therapy schools. So
Well, don't worry, they didn't teach it in chiropractic college either. And when I talk to my friends that are PTs or acupuncturists, they didn't get it either.
yeah, so trying to figure all that out. So I feel like I was like learning so much at once of how to do all that.
This podcast is called the Trust Driven Podcast, and we talk about how to build trust, and usually it's focused on how do we do that through communication. But when you're working with those parents of those neurodivergent kids or the kids themselves, I would imagine that sometimes it highlights things we think might work in might kind of be a big deal. And if I meet you on the street, or, I work with you at the bank or something, become a massive deal, or they're magnified. Is there any lessons you can share with us as practitioners that maybe we overlook, but that in your world, working with those neurodivergent kids is really big trust builder?
Yeah, I think there's a lot of things. I'm thinking of more like practical things and also kind of, just for us, it's really important to have an affirming approach and being affirming to that population. And sometimes even having to kind of explain that to parents that because, sometimes we're the first line when a parent gets a diagnosis, their kid is autistic or, has ADHD and
Right.
they don't know maybe a whole lot about that diagnosis and what that means. And so they're looking for support, but they don't really necessarily know what that looks like. And a lot of parents sometimes, come in wanting you to fix XYZ and, explaining to them kind of what that really looks like. How can we help support them? But we're not going to be able to change who they are, that we're going to help them if they help them identify strengths. As I always like to work with parents with, well, if there are things that are challenges, how can we help them? How can we accommodate them? How can we teach them to work through those challenges? So just kind of overall having that approach and being able to explain that. And I do feel like that builds a lot of trust with parents. Some parents are pretty knowledgeable and are looking for that affirming support. And so when they see that we're using that language and that we're really careful about how we word things with parents when we're working with kids and what we, promise that we would never promise that we could do a certain thing, but really just being honest and working with partnering with them, I think is really important to build that trust. Yeah, so I think that's good. But also like with working with neurodivergent populations, like just even the way your office is set up, like, having sensory friendly things in our offices. And I think parents recognize that too, like our lighting and just practical things too.
Yeah, I think that's a huge deal. Like you came out to one of our events, and one of the kind of keystone lessons we try and do is in healthcare communication, only 8% of it is verbally communicated. And but for most of the time, offices ignore the 92% that's body language and tone. And I think that again, I would say like you probably take just like, oh yeah, everybody knows that. Like everybody knows to have these sensory, environments or the lighting. And yet when you walk in these offices, I could be like, Nope, they overlook that, right?" And even the idea of play therapy is kind of like, instead of battling out a verbal approach, let's kind of sneak around the back and get on the same side of things, right?
Yeah.
Yeah, can you
Exactly.
explain how that goes and why that's so effective in those populations?
Yes. I mean, even when you work with adults in counseling, it's hard for people to talk about their struggles and their pain points and
Mhm.
their emotions. So with kids, we can't expect for a 6-year-old to sit down and tell you about their struggles and problems. Kids don't communicate that way. So through play, we're bringing in their natural language. And so with play therapy, we're using that. We're trained in a way to facilitate those, we call it therapeutic responses with kiddos. We use a lot of, we call it child centered play therapy. And so it's kind of really, it's so interesting. You really get to enter that child's world and see things the way they're seeing it. And it's amazing. I'm always amazed. Like sometimes when you're working with a kiddo, you don't know like where the session's, where are we going? And then you hear about later that there was something that was going on in their life that matched what was happening in that session. And you're like, oh, that's what was happening. Like I had a kiddo he was taking swim lessons and I had no idea. But he was playing out some things in our session about floating. And I really didn't understand he meant like water, but it was so interesting. Later, I found out that he was working through those fears of his swim lessons. And so, kids really bring their stuff and the things that they need to work through in play therapy. And it can be really helpful for them
Yeah.
to learn in the moment. It provides like emotional regulation and things like that. Versus if you're just sitting talking verbally, you're not going to get there.
Yeah, that's funny. I mean, I'm 47 years old and like I'm like in couples counseling, when marriage counseling, my wife and I have gone, it's like I'm still nervous to have conversations, and it's with the most trusted person in my life, my wife, and then a trained person, and even I'm like hesitant, and I have all the words, I have the vocabulary to do it. When you're 6 years old, like I'm thinking, yeah. So the 6-year-old said they will even say they have pain because do they have a reference point for what normal feels like? In the questions I would ask a new patient, right? And if you're like, oh, is it numbness? Is it tingling? Is it sharp shooting? They'd be like, I don't know your words, and
Mhm.
And so it's fantastic that you guys go that route. And as you're describing it, Carrie, I'm secretly getting jealous. Like, so you get to sit there and play, like, and you get paid for this? Like, come on. I mean, it could
Yes.
be better.
Yes, I know. Some people are like, it's all you do is play." Well, I mean, it is a lot more than that, and sometimes it has its ups and downs, within sessions, but we love it. I really think it's an effective way to work with kids and helping them and helping parents. That's also our other passion because we can do this work with kids, but unless the parents are in tune to what we're doing and having that good trust and communication with parents about things that we're seeing in sessions that would be helpful for them to implement at home that would support the child. I mean, it's really not going to be super helpful for that kiddo if we don't have that relationship with the parents and can really bring that insight into to them so that they can also help support the kiddo at home.
When does play therapy kind of like lose its luster?
It depends on the developmental, where the kiddo, because you may have a kiddo that is, 10, 12, but developmentally they're a little bit younger. So sometimes play therapy is still effective, but usually the ages are from 3 to about 8. We're in the playroom, but we use play therapy skills with teens, with adults. There's things that we bring in to all ages.
I was just wondering that because when you said you work with teens, like, do they get resistant to play if on its face it looks like this is for a young kid or don't treat me like a child, like as we're developing. But what's like an example of play therapy for an adult?
So maybe using a game or something in a session and try that. We'd also like to use, sometimes we call it sand tray therapy, and that's kind of a type of play therapy where you use like figures to represent certain things. So like we might use something like that. So it kind of gets them out of their mind a little bit, and it really helps externalize some of the things that they're coming to therapy with. Sometimes it's a lot easier to talk about if you're creating something in the sand tray and really seeing it outside of that, and it creates a safe space for that. So it can be really helpful.
Interesting.
Yeah.
Yeah. I always wonder in these things, like, there's so many treatments that, there's one called DNS for rehab, dynamic neuromuscular stabilization. And it really comes from a group of rehab specialists who are watching kids develop and go like, hey, how did you develop shoulder stability? It wasn't, you didn't do like, 20 reps with a dumbbell or presses, right? Like when you had kids, like when they're 6 months old, they're not doing that. And yet they still develop these things. And so they just watch kids and these patterns, and they kind of have some developmental markers, like they call it the 5-month pattern and the crawling and all these things. And it's like one of the most effective ways to rehab somebody. But I'm sure that along the way, somebody was trying to convince them, like, give up on that baby crawling crap, man. It's so dumb, like, but you got to just love the therapists and the professionals that push through and were like, no, this is the key. Like a sand
This
tray,
is
right?
important.
Yeah.
Right. Yeah.
Hey, what'd you do for therapy? I brought a big tray of dirt in from outside. And they're like, what are you doing, man? I work next to a crazy person, but it
Yes.
works, it works. Yeah.
Imagine a practice where patient engagement is seamless and unified. With trust-driven care, connect with patients across text, email, social media, and Google Business Chat, all on autopilot. Empower your team to step in effortlessly and engage in real time from anywhere. Say goodbye to multiple software and hello to a simplified practice and life. Trust-driven care is the all-in-one solution to save time, boost revenue, and build patient loyalty. Book your demo today and watch your schedule start to fill up. Now, back to the show.
Going back to something you said earlier about, like, you provide a lot of, where I don't know what you call it, leadership tools, guidance for the parents, because I think you set up an interesting situation or a reminder. There are diseases where we're trying to get rid of them, an infection, right? Cancer, right? But then there are other ones like pain management, endocrinology, like if you have a thyroid issue or you have diabetes, like it's going to be a lifetime thing. But one thing I would love to know how you navigate is when you have those diseases that are spectrum diseases that are, psoriasis, for example, or what's the one where you lose pigmentation in your skin? Is it alopecia? Or that's hair loss? Vitiligo, right? And you see people with small patches where they've lost things. One of the problems that always happens in those is people research it on the internet and the blogs and the pictures are the most aggressive version of the disease usually, right? And so when you have a kid that's autistic and the parent goes online, I'm sure they see the absolute like far right side of the spectrum. And you're like, well, there are those children. Yours is not one. We're over in this area, right? How do you translate that, and how do you get that parent to trust your guidance of like the old don't make such a big deal out of this kind of state?
Yes, it's hard, and I do, I'm a parent too, and we worry about our kids, and so, yes, so sometimes a lot of our work, I feel like, is helping parents to cope with their own worries and anxieties about parenting and, like, jump into the worst case scenario, and that's why we really like using a strengths-based approach too, is sometimes the parents really focused on this behavior that, is bugging them, but they're not seeing the strengths and the things that the kiddo can do. So kind of helping them to see that and to build on those. Yes, I do feel like a huge part is it's almost like we're providing counseling to parents too, because they just need a lot of support to navigate those anxieties and to still build connections with their kids, that we're really working on that relationship. And so a lot of times, like with play therapy, younger kiddos, we call it parent child. Sorry, I lost my.
Yeah, that's all right.
But
I
helping
totally
them.
think of vitiligo, so don't.
It's almost like working on their relationship and how can we build their connection stronger. And when you're in the heat of it as a parent, especially if you're having significant, stress in your life and your kid is, having all these behaviors and struggles at school, it's so stressful for parents. And
In the communication research that I've looked at, it highlights this fact of, this idea of, we just phrase it as making sure you understand your patient's goals. And I think sometimes we get so disease focused. It's like, oh, we're going to do this to attack that disease. And you forget, I had a friend that recently had he basically had a really big aggressive wart on his foot. Right. And they're like, oh yeah, we're going to attack this and do this and get rid of it. He's like, great. Nobody told him that he needed to be on crutches for 8 weeks. So he had like business trips and all this stuff. And he's like, I would have totally changed my schedule. And it's like, if they were going to remove a large chunk out of your foot, you would be like, yeah, you can't walk normally and travel normally. But nobody ever brought that up. And he was like, so here they were focused everything on how to remove this, this growth that we didn't want, without looking at, oh, that actually is on a person's foot. It's not on some robot, or it's not a part that doesn't get used every day. And I remember thinking like, gosh, I've done that. I forget that, somebody in low back pain, they're in pain all the time. They're taking care of a young kid. Like I had this woman and she just had a baby and some low back pain. And somebody was like, why don't you tape her? Like, kinesio taping. I was like, well, I really wanted to focus on this and that. And my friend stopped and said, okay, she has a 3-week-old. You think she's sleeping? You think she's eating properly? Like, give her every supportive device you can find, and then find 5 more and give those to her, because there's no option of taking it easy. There's no option of resting at that period in her life. And I was like, oh, yeah, I didn't look at the context of that. And, in some of these mental health games, like we forget they're coming to you, and then they still got to navigate school for the next 8 hours a day for the next 5 days. Right. And that's so hard. So again, going back to that building trust, how do you get the kid to trust you, your methods, your suggestions, all those things, that they'll work when they're used to an environment of maybe school doesn't work for them?
yes, I think it's really important for us as therapists to build rapport, and we really work hard on that. The first few sessions, that might be all we're doing, is helping them to get to know us and to feel comfortable. With younger kiddos, using that child-centered approach, it's like the ball is in their court, and we're not going to push it more than they want to go. And so we're not forcing them to learn skills and strategies right off the bat, right? We're really trying to get into their world and to really understand them. And so I really do think our therapists do a wonderful job of building rapport with kids, and usually kids really enjoy coming. Sometimes it is hard because, when we do get to know them, when we kind of get into some of the things we're coming in for, like, it's not always fun, play therapy, if we're talking about, big emotions and feelings that are hard, but creating that safe environment is helpful.
Yeah. it's like you're talking about like a microcosm of how healthcare should go, like build rapport and a relationship first, and then we'll handle everything second. But, I do this in my life. I do this with my patients is sometimes at my worst. I don't want them to suffer another second. So I jump in with the solution right away and I just overwhelm them and smother them in the solution before we have a relationship and trust each other. And there is a place for that, but knowing where that place is so difficult. As me as a human, it's so difficult to manage sometimes, navigate.
And I think when you think about kids, I mean, they're getting told all the time, their parents are telling them do this and their teacher, so it's rare for them to have a space where they just can come and they can be in control and they can take the lead. So I think it's a really different opportunity for them. And so sometimes we have kids that are like, whoa, this is different. And it's almost uncomfortable because they've never had that, before. So it's a little bit for them to get used to.
Yeah. Yeah, that is a very funny feeling of like, I want freedom, and then you get the freedom or you get whatever. And it's like, wait, are you sure this is okay? Yeah, this is unsafe. It feels, and man, you're highlighting so many things that you experience with kids, but again, I think it's just clear magnification of what goes on throughout entire healthcare. There are probably 80-year-olds in getting some sort of therapy saying, God, I wish they would form a relationship with me. I wish we had a sand table,
Yes.
Let's switch real quick to talking about business. First off, you have, from my perspective, an interesting approach. So you have many different therapists, but almost none of them are full-time, Monday through Friday kind of folks, right?
In our industry, usually in private practice, if you see because we see clients for a full hour. So if you're seeing like over 20 clients a week, we consider that full time because then you add on all the administrative paperwork.
That's 20 hours of like, you got to be engaged in play, not like off on the side writing notes, right?
Right. It's not including all the documentation and all that. So all of my therapists except one are full time. From that sense. But we try to, with working with families, we have flexible schedules. And so, sometimes they're in the evening or sometimes they're.
Yeah, I was going to ask that. Is this mostly an after school type out, like 2 p.m. to maybe 8 p.m. kind of timeline?
That's definitely what those sessions, like we're usually always full after school.
Yeah.
We do see kids during the day, especially younger kids. Elementary schools in our area are pretty good about accepting a doctor's note to, excuse their absence. So we write notes for absences if they come and see us during the day. So we do have kids we do see during the day, but we stay fully booked. Usually all of our after school sessions or weekends.
Yeah.
Pretty booked up.
Going to this idea of like building trust, what are some things you've noticed build trust with your team as you've been growing a lot over the last couple of years, and that means there's new faces, there's different roles, right? Nothing has stayed the same in some ways. What are some ways that if somebody is growing and adding people, can you identify some suggestions, best practices, pitfalls that you have about working with a growing staff?
I mean, I think it's important to have good systems in place. And, that's one of the things that, I wish I would have had something like trust-driven care when I first started, because when it's just you and you're the one that's, answering the phone and calling people back, it's hard because, you're in sessions 6 to 8 hours a day. It's like, when do you have time to do all that?
Right.
So.
And I'm sure the same time you're getting the phone calls is the same time the sessions are the most popular. So it's like double yours.
So I felt, as we've grown, I feel like having really good systems in place for communication, like we've always had and valued that initial contact that we have with people coming in, because they're usually at a vulnerable state. I mean, it takes a lot of courage to reach out to a therapist, and usually they're ready for help. So we really try really quickly to respond to, those initial inquiries. And, I've trained all of our therapists on how to do those intake calls in case we ever need to step in. Right now we have an intake coordinator, but sometimes like we'll have a crazy week where we get flooded with inquiries where she can't respond to all of them. So we'll have to step in and make sure that we help cover that.
Can you real quick define the role of an intake coordinator? Because I see that a lot in almost every mental health practice we serve, but there's not like a synonymous role in like a chiropractic, physical therapy, acupuncture.
Yes. I mean, she definitely, we don't have an in-person receptionist at our office. I mean, I hope someday we will. So she is the one that responds to our phones and any inquiries that comes in. And what she usually does is try to call clients back and set up some type of consultation to see if our services would be a good fit and to match them with the best therapist for the situation that that's calling in. So she kind of is like the point of contact for all new
It's
new
almost
people
like
coming in.
your initial consultation, not a medical consultation, but just like a what service do you actually need kind of thing.
Yes, and yeah, and she'll help, with all the logistical things like insurance and answer all questions like that. And then she'll set up the initial appointment with the therapist. And so, and once the therapist has them on their caseload, they kind of take over from there. But she's the one that kind of is that first point of reference.
And from what I've seen in other mental health practices, she's also kind of the one that can make an early decision of we're not the right fit, but we can help you find the right fit.
Mm-hmm.
Yeah, I think that's an interesting one because oftentimes, like in the chiropractic space, like they'll go through the new patient exam, get treated a few times, and you realize, oh, you might do better with X treatment. Now, obviously, if you suspect cancer or infection or something, you're sending them off right away. But I do see that defined role up front, but they're not a licensed therapist, counselor, social worker, right?
Right. I've been fortunate though, the intake coordinators that I do have are grad school students, so they're very interested in the mental health field or working towards becoming a therapist down the road.
Smart. Okay.
Mhm.
Yeah. That's a good, you always want to find somebody that's highly skilled and eating ramen at the same time as a business owner. Yeah.
Yes, somebody who, yeah, and is passionate about mental health.
Yeah. Yeah. And they understand the basic language and all those things. That's great. So going to those systems and communication, obviously you use trust-driven care, but what were some advancements or milestones you think you came up with? Because you and I have had discussions about like, I remember the discussions about like setting up a way for your intake coordinator to kind of push people to the right therapist and make it, I don't know what you would say, quick and seamless for that person to see who they just got added and whatnot. But what were some big steps you took that you feel like really systematized your practice? Because
Yes.
let me tell you too, one of the reasons I'm asking this is we've seen this uptick in discussions around people using our system to systematize things, and they almost always a month later say, I was getting pretty burned out, and so I'm glad I built that system. I was getting pretty burned out, but this took the pressure off. And I never expected that. I never thought that would be a pain point,
We get a lot of referrals just from Google search and people kind of looking around, online for therapists. And so a lot of them come through our website. And so what has been really, I feel like amazing is there's like a short form that they fill out. And after that, it links to the intake coordinator's Jane schedule so they could schedule after they fill out. So we're collecting that information through Trust Driven Care, on the front end. And also they can set up a consultation call right then. And then after that, they get all the automations like, thank you, for setting up this call. We'll call you at the, certain time. And then it goes into the pipeline. We love the pipelines in Trust Driven Care because that really helps us, stay organized and we can see the leads that are coming in and where they're coming from. And we have like different stages, like if we schedule the consultation call or, we need to call them back. And so, if my intake coordinator is sick that day, I can log in and see where everything's at, if I need to follow up on anything, if there are any calls I need to cover for her for that day. So that's been super helpful. And I've used that feature for a lot of other things. Like when we went to the live training, it was so cool that, that hospitality and really making us feel welcome. And it kind of inspired me to offer something for our community. So we're doing free parent workshops once a month. And we have a really good relationship with our schools. And, school counselors are always looking for free resources to give to parents. So we kind of have used that to market to our school counselors. But all of it's automated. So, they register and, I can see them in the pipeline and I can, all the messages are going out automatically. So it's been really helpful to have all that set up, and like every month I'm thankful for it. I'm like, oh, this is already kind of done, so I don't have to redo it,
It's
and it
fantastic.
helps us to follow up on all those. So it's been really cool.
Yeah, I think the pipeline idea of like just visualizing what's going on in the practice helps so much because, the sometimes just the amount of different things that are going on is overwhelming. And if you can just be like, all right, well, these are the only things that Carrie has to work about. And these are the only things that Josh has to worry about. And these are the only things Jenny has to worry about. Reduces that problem and that stress. But one thing you mentioned before we started recording along these lines is you said you recently got a new intake coordinator or you added somebody. And since you had these systems and they're visualized, it sounded like ramping that person up was much
It was
quicker than you
very
kind of thought.
seamless, right? I was kind of worried, that my old intake coordinator, she finished her grad program, and she's not local and she went somewhere else. But I was worried about like things getting dropped, with the transition, and because we get a lot of inquiries, a lot of calls, and some of them we've already kind of talked to, and so we need to follow up with. But it's all been, and I think because of how we have it organized and the system, it's all been pretty seamless. And our new person stepped in, and it seemed like she caught on really quickly, and yeah, she's
Yeah.
loving it.
How long did it take you to get her up to speed with the coordination?
I mean, I met with her for a couple days, and then our old intake met with her for a day, and she was good to go. And it was so funny. It was like that next week when it was just her, we got I don't know what happened, but like our phone was ringing off the hook. And I was so thankful, because at least I know we're not losing anything that's coming in, right? It's there.
Yeah. Yeah, I think that's even Google says like I can't remember, like 80% of healthcare practices don't answer their phone the first time a patient calls. And so the patient rolls to the next one and calls the next one and the next one. And all these, when you talk about strengths in the counseling session, like let's take a strengths-based approach. I always think like in the business side, like let's take a cheap and effective approach. Like number one, answer your phone. Like if you answered your phone for everybody that called, how much more business would you have? And just doing that and answering the messages. Do you guys get messages through like Instagram or Facebook or any other social channels?
A whole lot. And we are trying to, build a better presence on the social. So maybe I'm hoping in the future that will be, I've been kind of experimenting with marketing and like sponsor things with the social media. And I feel like it's been pretty effective. So
But you do get some inquiries on your website too?
yes, we get
Yeah.
a lot of them come through our website.
Yeah, and for everybody listening, like I am shocked at how many times we are installing the first like web chat widget, like the ability to answer questions or get from people's websites. So many people have websites and then it's like, well, you need to call between 9 and 5 and hopefully somebody picks up. And if you just have a place where they can ask questions, hey, do you take this insurance or do you have any appointments like on Wednesdays? In my experience, and Carrie, I would love to know, the questions you get on a website usually are people that are already decided, I want to come to you, but they're just trying to clarify something like, do you have evening appointments? Do you treat on Fridays? Do you accept new patients? Rarely are they deal killers, like they're coming in.
Right. Right. It's been super helpful.
Yeah.
And when I see the ones coming from the chat bot on the web, I'm always like, let's, let's as soon as we can. Yeah.
Yeah.
It's kind of fun.
And what are typically the questions you're seeing on there?
A lot of, like you just said, like, do you accept this insurance, or do you, have openings on this day? Things that are pretty logistical.
Yeah. Things that basically, if you say yes, you got to pay a new patient, right? Yeah. Yeah. It's so funny. Like if you just answer your phone and just answer the questions on the website, you end up, as my friend calls it, you just have so many fishing poles in the water, you're guaranteed to catch fish,
What I love, I think, maybe the most about the trust-driven care automations, sometimes we can't answer our phone all the time, and we have that automatic text back. But like, thank you for
Mhm.
giving us a call. Feel free to text us back what you need. We'll get back to you. He has like so many responses from that. And I think about some people are just, easier to text, like they're comfortable with that. And
Yeah.
um,
I am. I don't know about you. Like
yeah.
I mostly communicate through text and my friends and family. Like,
Yes. So we get a ton. I feel like I feel like for the majority of people that reach out that are looking for help, they're pretty comfortable texting back, and
great.
that's been really helpful.
Yeah. And when you're texting people back and they're calling, you ever track what percent become patients or?
I have kind of played around. I think it's between 50 and 60%. And, we don't take every insurance. I feel like that's a big one right now. I feel like from what I've heard in the mental health world with the economy, things have kind of gone down. We haven't seen that as much because we do take some insurance. And I feel like those are the ones that usually end up booking, or especially if we take their insurance.
Okay. But 50 to 60% of phone calls, like, and all you got to do is text them back and they say, yeah, I want to come in. That's not bad for any business, especially in healthcare. All right. Well, last question, like for you as a business owner, any systems that you wish you would have had installed long ago, anything that gives you clarity, reporting, organization, dealing with, interpersonal stuff or office, the people in the office?
I mean, like I said, I wish I would have had something set up more, even when I was first started. It's like you don't know what you don't know when you're starting out. And you don't know all the business stuff.
And without that pain that you developed, you never would have such an investment in staying up late to build these things, right? Like,
yes, but now, it just really, it helps us build confidence as a business. The things that we're doing are working, the systems are working, and I'm excited to build even more things out that will make help even more accessible for people, and I think having the systems and things that can do that, it's exciting. I love it. And I hope I can spend more time on implementing more things in the future.
Yeah. Yeah. You're at that tough stage of you're still, and we see this a lot, you're the owner and still an active clinician providing a lot of revenue, right? And not quite up to the point where you can pull out of that and have everybody else doing it for you. You'll get there. You're well on your way. I mean, I'm always been impressed with you because for the listeners, Carrie signed up on I can't remember, Monday for our software. And I said, hey, we're actually offering a live event this weekend. You should come. And she was there in Vegas by Friday afternoon. And it was like the most impressive transition, but by just the change from where you were on Saturday morning to Sunday afternoon was, I think, incredible.
Yes, and that training was so helpful, to kind of be there and to be, where we can ask questions and get everything set up and going. So it was an amazing experience. But yeah, I'm so glad I took the chance to do that. I was like, is this a spam? We're going to go to Vegas in 3 days, and yeah, I'm hoping this will be.
Well, the worst case scenario is you spent a couple days in Vegas with your husband, right?
Right. But yes, it was totally worth it, and I'm so glad that we did take the jump and get everything going like we did.
Yeah. And tip of the cap to your husband for riding shotgun. He's a tech guy, but he's not even in healthcare, right? But I thought that was it was just perfect to have him there because I thought he kind of helped you with the technical stuff, but your clinical language, your knowledge of how people are was like the perfect combo. Just it's like the stars aligned for that all to happen. So fantastic. And I was so happy that you were there.
Yes, we loved it.
Great. Well, Carrie, if people have questions that are in the mental health space or work with kids and maybe they have questions about anything we talked about on this podcast, you mind if they reach out to you?
Sure. You can find our website is reachcounselingtx.com. That's probably the best way to get a hold of us. And yes, I would love to talk to anyone.
Yeah, I think just people hearing those best practices, they're like, how are you handling this? And once you have the solution, gosh, it's so empowering, it's so empowering. Awesome. Well, thank you, Carrie, very much for the time today. I really enjoyed talking to you. And this was your first podcast. How do you think it went?
It was a little nervous.
Yeah, but I think it went fantastic. And I certainly say thanks for the time. So on behalf of Carrie Manning out there in Texas, this is Josh Satters saying go out there, build trust with your patients, and be amazed at the outcomes. Thanks, everybody.
Thanks for tuning in to this episode of Trust Driven Insights, brought to you by Trust Driven Care. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of trust-driven care. If you're ready to streamline your practice, check out trustdrivencare.com and see what's possible. Trust-driven insights, real conversations, smarter care, stronger business.